Welcome everyone to Chapter 12, Assessment of the Heart and Peripheral Vascular System. This chapter will equip you with the essential skills to thoroughly evaluate the cardiovascular health of your patients. We'll be diving deep into the anatomy, physiology, and assessment techniques necessary for providing optimal care. Here are our learning objectives for this chapter. By the end of this session, you should be able to confidently relate health history data to potential cardiovascular issues, accurately describe examination techniques, and interpret your assessment findings. We'll also cover variations in examination results, common problems, and the crucial concepts of oxygenation and perfusion. Let's start with a case study. Yvette Jackson, a 79-year-old woman with heart failure, presents with symptoms stemming from long-standing hypertension. Her reduced cardiac output and fluid leakage are impacting her daily life, leading to fatigue and other complications. As we go through this chapter, consider how the assessment techniques we discuss would help in managing Yvette's care. Before we dive into the assessment, let's review some key anatomy and physiology of the heart. Remember the chambers, valves, and major vessels, as they all play a critical role in cardiac function. Understanding the difference between diastole and systole is fundamental to understanding blood pressure and cardiac output. Blood pressure is a vital sign that reflects the force of blood against the arterial walls. It's influenced by cardiac output, which is the amount of blood pumped by the heart per minute, and peripheral resistance, which is the resistance to blood flow in the arteries. Remember that cardiac output is further determined by heart rate and stroke volume. When taking a health history, it's important to cover both problem-based and general health aspects. For problem-based history, focus on symptoms like chest pain, shortness of breath, and edema, using old charts to analyze them thoroughly. Don't forget to explore general health history, including past illnesses, family history, and lifestyle factors like exercise, nutrition, and substance use. These are the routine techniques we'll use for a physical examination of the heart and peripheral vascular system. We'll measure blood pressure, inspect the jugular veins and extremities, auscultate the apical pulse and heart sounds, and palpate peripheral pulses. Calculating pulse pressure and pulse deficit will also be covered. Accurate blood pressure measurement is crucial. Ensure you have the right equipment, use the correct technique, and select the appropriate cuff size. Remember the Korotkoff sounds, which represent different phases of blood flow as you deflate the cuff. Let's consider some important questions related to blood pressure. What does an abnormal blood pressure reading signify? How does cuff size affect the accuracy of your readings? And how do you properly obtain and interpret orthostatic blood pressure measurements? Here's a scenario to test your assessment skills. A 72-year-old patient on hydrochlorothiazide presents with lightheadedness and dizziness. What do you hypothesize is happening, and what assessments would you perform to confirm your suspicion? Use the provided options to fill in the blanks and prioritize your actions. Inspecting the jugular veins can provide valuable information about fluid status and cardiac function. Look for pulsations and distension, and note any abnormalities. What findings would you expect in a healthy patient, and what might abnormal findings indicate? Let's test your knowledge with this application practice question. How do you accurately determine jugular venous pulsations? Consider the different methods described in the answer choices and select the most appropriate one. Palpating the apical pulse or point of maximal impulse, PMI, is an important part of the cardiac assessment. Where would you expect to palpate the AP in a patient with ventricular hypertrophy? Remember that the location can shift due to changes in heart size and position. Auscultation, or listening to the heart sounds, is a critical skill. We'll discuss the proper procedure for auscultating the apical pulse and heart sounds. Remember to use your stethoscope correctly and listen carefully in each of the designated areas. S1 and S2 are the primary heart sounds, produced by the closure of the mitral and tricuspid valves, S1, and the aortic and pulmonic valves, S2. Pay attention to the timing, pitch, and location where these sounds are loudest. Remember that you're listening to the flow of blood away from the valves, not directly over them. Let's test your understanding of the auscultation procedure. Consider these multiple choice questions about patient positioning and stethoscope usage. Selecting the correct answers will ensure you're performing the assessment accurately. This diagram illustrates the auscultation points on the chest wall: aortic, pulmonic, Erb's point, tricuspid, and mitral. Use light, firm pressure with your stethoscope and systematically auscultate each area. If heart sounds are difficult to hear, try different patient positions or maneuvers. Now, let's discuss abnormal heart sounds. Friction rubs, S3 and S4 sounds can indicate underlying cardiac pathology. A friction rub suggests inflammation, while S3 and S4 sounds can indicate fluid overload or a stiff ventricle. Splits and murmurs are other types of abnormal heart sounds. A split occurs when heart valves don't close simultaneously, while a murmur is caused by turbulent blood flow. Understanding the mechanisms behind stenosis and regurgitation will help you interpret these sounds. Using this diagram, consider where you would best hear a murmur in patients with mitral valve prolapse and aortic stenosis. Remember that the location of the murmur depends on the affected valve and the direction of blood flow. Here are some more practice questions to reinforce your understanding of cardiac auscultation. Which area are you auscultating when you listen at the second LSB? And what kind of murmur would you expect to hear in a patient awaiting mitral valve repair? Calculating pulse deficit and interpreting EKG results are additional techniques for assessing the heart. Pulse deficit indicates a discrepancy between heartbeats and palpable pulses, while EKG interpretation provides information about the heart's electrical activity. Remember that EKG interpretation is not typically performed in children or young adults. Now, let's move on to the peripheral vascular system. We'll start by palpating the temporal and carotid pulses. Remember to assess the amplitude of these pulses, which reflects the strength of the pulse wave. During each cardiac cycle, a pressure wave travels down the arterial tree, allowing us to palpate pulses. Use the pulse amplitude scale to document your findings accurately. Remember that a normal pulse is graded as 2+. When examining the upper extremities, inspect and palpate the radial, brachial, and ulnar pulses. Compare the pulses bilaterally and note any differences in amplitude or rhythm. What findings would you expect in a healthy patient, and what might abnormal findings indicate? Next, we'll examine the lower extremities. Inspect and palpate both legs, paying attention to skin color, temperature, and the presence of edema. Measuring leg circumference can help assess for fluid retention. Palpating the femoral, popliteal, posterior tibial, and dorsalis pedis pulses is essential for assessing lower extremity circulation. Use the diagrams to locate these pulses accurately. Remember to compare the pulses bilaterally and note any differences. If you're unable to palpate a pulse, use a Doppler device to assess blood flow. The Doppler can amplify the sound of blood moving through the artery, allowing you to determine if flow is present. The pitting edema scale is used to quantify the severity of edema. Press firmly on the skin and observe the depth of the indentation. Use the scale to document your findings accurately, ranging from 1+ to 4+. Let's apply your knowledge with this nursing application practice scenario. A patient has a 4 mm depression and a diminished dorsalis pedis pulse. How would you document the pitting edema and the amplitude of the pulse? Here's another practice question to test your knowledge. Where do you palpate the posterior tibial pulse? Consider the anatomical landmarks and select the correct answer. In special circumstances, you may need to auscultate the temporal and carotid arteries for bruits. A bruit is a blowing sound that indicates narrowing of the artery, which is a risk factor for stroke. Palpating epitrochlear and inguinal lymph nodes can provide information about infection or inflammation. Also, calculating ankle brachial indexes, ABIs, can help estimate arterial occlusion in patients with peripheral arterial disease. Palpating the precordium is an advanced technique that involves assessing the chest wall for pulsations, thrills, lifts, and heaves. This technique requires specialized training and is typically performed by advanced practice providers. Now, let's discuss some common cardiac problems and conditions. We'll cover heart failure, valvular heart disease, angina, and other conditions that can affect the heart and peripheral vascular system. Heart failure can affect the left or right ventricle, or both. It occurs when the heart is unable to pump enough blood to meet the body's needs. This can be due to weakened heart muscle or stiff heart muscle. Left-sided heart failure leads to pulmonary congestion and symptoms like shortness of breath, cough, and fatigue. The elevated pulmonary capillary wedge pressure and other signs listed here are indicative of this condition. Right-sided heart failure, also known as cor pulmonale, leads to systemic fluid retention and symptoms like edema, ascites, and jugular vein distension. These symptoms are a result of the heart's inability to effectively pump blood to the lungs. Valvular heart disease occurs when the heart valves don't open or close properly. This can lead to stenosis, where the valve doesn't open fully, or regurgitation, where the valve leaks. Angina pectoris, or stable angina, is chest pain caused by ischemia of the myocardium. It's often triggered by exertion and relieved by rest or medication. The clinical findings listed here can help differentiate angina from other causes of chest pain. Acute coronary syndrome includes unstable angina and myocardial infarction. It's characterized by severe chest pain and can lead to death of heart muscle. Prompt recognition and treatment are crucial. Let's apply your knowledge with this application practice question. When a patient complains of chest pain, which question is most pertinent to ask to gain additional data? Consider the answer choices and select the one that will provide the most valuable information. Pericarditis is inflammation of the outer membrane of the heart. This inflammation can cause chest pain and other symptoms. The diagram illustrates the inflamed pericardium surrounding the heart. Peripheral vascular disease encompasses a group of diseases that affect the peripheral arteries and veins. These diseases can lead to blood flow disturbances and various complications. The diagrams illustrate the arterial and venous systems. Hypertension, or high blood pressure, is a major risk factor for cardiovascular disease. It's diagnosed based on an average of 2 or more properly measured blood pressure readings above 120/80 mm Hg. The diagrams illustrate the progression of vascular damage caused by hypertension. Here's a summary of hypertension, including normal blood pressure values, screening recommendations, and clinical findings. Remember to screen all adults annually and to monitor lipid levels in those at risk. Let's test your understanding of blood pressure readings. Which patient has a blood pressure consistent with expected findings? Consider the values provided and select the one that falls within the normal range. Thrombophlebitis is inflammation of a vein that may or may not be accompanied by a clot. The diagrams illustrate phlebitis and thrombophlebitis, and the photograph shows the clinical findings of redness and swelling. Venous thromboembolism includes deep vein thrombosis, DVT, and pulmonary embolism, PE. DVT is a blood clot in a deep vein, while PE occurs when a clot travels to the lungs. The image illustrates the formation and progression of these conditions. What is the most accurate technique for detecting a venous thrombosis at the bedside? Consider the answer choices and select the one that provides the most reliable information. This image compares the symptoms and physical manifestations of peripheral artery and venous insufficiencies. Note the differences in pain, pulses, color, temperature, edema, skin changes, and ulceration. Let's apply your knowledge with this application practice question. Which additional data would indicate that a patient with shiny, taut skin and little hair growth on his legs has peripheral arterial disease? Here's another practice question to test your knowledge. Which question should you ask for further data when a patient complains of calf pain while walking? Finally, let's consider this practice question. A patient with congestive heart failure has edema and dry skin, and you can't detect the dorsalis pedis pulse. What's the best action to take? Thank you for watching today's video on cardiovascular system disorders. I hope you found it helpful and informative. Don't forget to like, subscribe, and hit the bell icon so you never miss a new video. Also, feel free to drop any questions or comments below, and I'll see you in the next video. Don't forget to answer those questions.